All right, ladies and gents, let's get started. Today we have today we actually completed. We've completed all of our teaching. So today's reviews. I'm going to review now your first in-course assignment. I review the lecture from last week as well, and then start over from lecture one with all the reviews. Well, with everything that we've done so far. All right. So off the bat, I would like to say congratulations to my top scorers in this exam, which would be dum 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 Jahil and Sarah Ramkumar. You both of you did really well in your exam, and I congratulate you. All right. For those of you who didn't do so well, I always say it's an opportunity for you to now look at where you may have gone off course, and perhaps ask other students who can assist and help in how you go about approaching and answering your questions. I noticed there was some improvement with some students from this exam compared to the others, and I encourage you all to keep striving and to keep getting and doing better. Okay, so just wanted to share that grade. So let's look into the first. Let's look into the how what I the review for the exam. So by using a concise definition of public health, round of applause for Sarah and Jahil. That's what needed to do that. Using a concise definition of public health, explaining need for public health in the context, including the context of the COVID-19 pandemic. So simple definition: public health is one of those efforts organized by society to promote, protect, and restore the people's health. This COVID-19 pandemic has been has led to a massive loss of life very quickly and in a very inconspicuous manner. I was hoping, students mentioned that because it was novel, it was a novel coronavirus, so its transmission wasn't completely understood initially, which is why there were so many missteps by the World Health Organization and other agencies that were hesitant and reluctant to take the necessary measures early on, such as mask wearing, and we all know the huge failure that has led to. Um, so I wanted persons to mention that because it was having a massive impact on the world, things was happening very quickly and was happening in an inconspicuous manner. Nobody would have thought that by having a conversation with somebody, it can cause them to develop coronavirus or contract coronavirus, and they may not survive, right? Because we weren't getting a clear profile initially on what the affected patients were like. Public health mechanisms were put in place early to immediately contain the spread whilst learning about the new virus. So this is where public health started to come in, taking early steps, immediate steps to contain the spread whilst we still learn about the virus. All right. Um, and from a public health perspective, I wanted you all to appreciate that losing a number of persons, a significant number of persons in a short space of time, will have induced a lot of mental stress and fears amongst the population. It could reduce the general size of the population, there's the potential to do that. And by affecting so much of the population, it's also going to affect productivity, domestic GDP, for example, gross domestic product. If you have a lot of your industries that are that are that are being affected because persons can't come to work. Just 1 minute there, right? Right. So as I was saying, um, so when we have one of the major things that a public health authority and department does is to ensure the health of your general population, and one of the main reasons for that is productivity. I've been saying that public health efforts and all health efforts generally are for the restoration of person's health so that they can get back to having a productive life. And a productive life, yes, we'd be inclined to think they can go out there and work and they can have jobs and they can earn money, but a productive life can also mean being some sort of support. Grandparents or parents or guardians who might have to help take care of children. These are the this is the purpose of person's health. So public health in particular is ensuring that a large amount of your population remains healthy so that they can remain productive, so that it doesn't affect what, like, and I use the example of gross domestic product, the GDP. All right. So by reducing the production capacity of communities and leading to economic distress. Economic distress is what public health efforts are trying to avoid. Public health plays a role in the rule of law and policy creation to force stakeholders to adhere to health the necessary health-based instructions. And these health-based instructions were issued on a macro scale in order to protect vulnerable groups. So I was hoping that you mentioned the vulnerable groups when it was realized that it was persons above the age of 60, it was persons with comorbidities. Public health efforts were necessary to protect that group. The public health purpose is also to advise on corrective measures to adopt for prevention and effectively treat those already affected. So that's an important role that public health has in this pandemic. And the public health approach to the pandemic should be one of the same thing: define the problem, identify the risk factors associated with the problem, develop and test solutions, implement those solutions, and monitor. So that was what I was looking for with the first question. For the second question, how can ICT strengthen pharmacy practice within large public-based institutions, and how does the COVID-19 pandemic make a case for its implementation? Now, off the bat, I was hoping that persons um, spoke about integration, ICT allowing integration with all clinical departments. Remember, the question was with respect to a large public-based institution. A large public-based institution most likely is going to be a tertiary-based institution, like a public hospital. So there are several clinical departments, there are several non-clinical departments, integration with ICT and pharmacy with all of them to help with and facilitate enhanced drug selection, drug administration, real-time patient monitoring, widely therapeutic options available for prescribers, better communication between all stakeholders within the healthcare framework and with end users. And finally, restocking. Yes, ICT will help with restocking as well. Some of you went on to talk a lot about restocking and a lot more about inventory controls, and was not necessary. I wanted it to be a little more um, large management perspective. So for COVID-19, remember COVID-19 is about an illness that is promoted when there's crowding, and we all know public hospitals have a tendency to be crowded. So it requires that we have the least amount of in vivo type interactions, the least amount of human to human interactions for now. ICT can help with scheduling patients. I was looking for a person saying that we have no scheduling patients to come in for collection. Remote counseling, the counsel remotely facilitate, then this would facilitate less exposure to staff and the patient from either one, from patients being exposed to workers, from workers being exposed to patients. Use of social media groups and medication info download packets. There are videos that you can email to persons. And I said just now about remote counseling face to face, but in video interaction for the patient's access and to be more involved in reporting on and record adverse events. And this ICT can facilitate a change in outpatient clinics the way it's done compared because of the coronavirus pandemic. So those were some of the points I was looking for with that question. Are we good so far? And finally, describe how COVID-19 has affected factors that determine health financing. So remember, health financing has to do with things such as, yes, the availability of resources, risk pooling, and um, and health purchasing. Yes, all of those. Where do we get your money from? But health financing also is affected by epidemiological transitions, such as shifting from uh, caring for elderly and caring having to care for illnesses that are affecting children. In this case, it was coronavirus. So you're having a shift of focusing on funding on even more so on the elderly, even more so now on that vulnerable group of persons over 60. Whereas the young folks were happy and healthy and can go about. There were very few effects happening on persons below the age of 40 or below the age of 50. All right. And then there is the demographic transition, demographic issues with the age of, sorry, my apologies. That was demographic transition I spoke about with respect to age. The epidemiological transition was moving. We have been spending a lot of time and money and effort internationally on chronic disease and its effect on the world and health promotion for chronic disease. But now we are seeing an epidemiological transition from chronic disease. Yes, although it's there, but we now have to include some more and spend some more emphasis and some more time on infectious disease. So this is where there's a shift, there's an epidemiological shift as well. More epidemiological, more emphasis on the infectious disease. All right. Um, as a result, you're going to be now requiring more money to treat with that age group of the persons over 60. You already had to subsidize that age group. Now even more so, you need to have it subsidized. So clearly, national health financing would not be enough, and you'd want to have social and voluntary health financing plans as part of it to cover the cost. So these are some learning tools that would be going forward for countries with respect to health financing. So the epidemiological transition, demographic changes, yes, risk pooling, yes, health purchasing, um, and also accepting and understanding that the national um, uh, health system based funding will not be able or is getting tested to the max, and clearly it should have allowed for more private based and more voluntary based, more social based health financing to be used. All right, so that's the review of the first in-course assignment. I hope everyone understands the position. I again encourage persons, when you're answering the question, read the question over, look at the relative PowerPoints that are relative to that question, look at the video, and critically think. Do some proper research. If you are indeed doing lots of research to answer the question and make sense of the information, keep your word limit within intact, please, but try and answer the question. All right. Remember, your courses are management courses, and at times I would include some clinical components, but I want to see that you understand the different considerations and concepts from a management perspective in answering some of these questions. All right. Good. So congratulations again to Sarah and to Jahil. You all did well. There were some others that were right up on their heels, right up on the heel of Jahil. Um, People like Videsh, people like Amelia, Dylan, Kai, you all were right up there close by. So well done to Videsh, Amelia, Dylan, and Kai. So good. Well done. And let's, you all have any questions on the first exam? Well, I mean, it's done and over. Everybody got their grades. So let's now move on to reviewing what we did last week, which was self care management, self management support. And the very second slide, or slide number 2, is essentially what we want. And I said that in the beginning. You want a health system and a community with their different resources to now feed into a relationship of an informed, activated patient interacting productively with a prepared, proactive healthcare team that makes for improved outcomes. So this is a really nice a really nice model or shape or figure that you can look at that can give an idea off the bat of what we want with self-care management. And we said self-management is not about patient education. It's patient education is didactic, patient education is lecturing, patient education is sage on a stage, where self-management support making your skills generalizable, making sure the person identify the problems that need to get solved and the patient gets involved in solving these healthcare problems. Right, we went on to talk about self management is important, so patients now take complete control of their health. We have a better partnership with the healthcare provider and the patient, and and appreciating that professionals are experts about diseases, but patients are experts about their own lives. They would know how they react to certain things. And while we might be trying to apply something that is a general sense, statistically, patients would know if they, in particular, react well to this drug or react well to this scenario, or don't react well to this drug and don't react well to this scenario. So, this is what self management is about: taking care of the illness, carrying out your normal activities, we're on slide 10, and to manage emotional changes. And I said emotional changes are a real thing because persons getting newly diagnosed with chronic disease and illnesses can at times affect them mentally and can allow them to not make good decisions. And what was the example I gave last week? Can anyone remember what was the example I gave with respect to these emotional changes? What was the disease example that I gave last week or we discussed last week regarding this emotional change? A student Jahil. What was the example? What about Sarah? Are you all with us this morning? What was the example that I gave? Or anybody can answer. Amber, I think Amber is in this class as well. Um, and I have the list. There were some people who I've never seen, um, like Valini Lakshman. Valini, are you in class this morning, Valini? I'd like to know. Um, Melissa Milan, I don't think I've seen that name come up. Neither have I seen, maybe I did see Sabrina. So the names that are not too familiar with Kezian, Kezian Atai. Um, you all could feel free to give me some answers. Hey, Sarah is here. Dylan says diabetes. Hi, Valini. Yes, yes, you're here. Yeah. Hi, Melissa. Right, good, good. What about Sabrina? Sabrina and Jessie Rakal. Sabrina Duku, Shanice Rajkumar, and Jessie Rakal. Are you guys with us this morning? And Allison. I know I've spoken with Allison, but Kezi. All right, okay, Kezi is here. Okay, good. Amber, what? Wait, Amber, what was the question? Amber, why you so? The question was, what was the example that I gave last week regarding the diagnosis of a disease that sometimes might have emotional responses to it, and there were some reasons we put forward. Diabetes, Dylan, not so much diabetes because if I answer you further, why it's not so much, I'll give away the answer. So cancer, that's yes, certainly. Certainly, certainly cancer. Kavita R, you got it. Kavita R got it. Hypertension. Why did we say hypertension? There will be some emotional responses. Yes, Karina? Hypertension, high blood pressure. Why? Why is hypertension and high blood pressure an issue? That's right, Kai. There are no symptoms. There are no symptoms, no visible signs. Yes, Chelsea. Correct. Ooh, I like all these responses I'm getting. Yes, hypertension is called a silent killer. And usually, persons who have developed hypertension, Karishma, people don't, that's right. There are no symptoms. And usually, when symptoms do appear, what is that? When symptoms do start to show up with high blood pressure, what do we say? What do we say? If symptoms do finally show up for high blood pressure, what do we say? Yes, Karishma, they think they're healthy. They think they're healthy because they have no symptoms. That's right. That's right, Chelsea. It's just stress. Yes, they say it's just stress. Yeah, stressed out. And yes, at times, believe it or not, stress can induce an acute form of high blood pressure. Yes, yes, I agree with that. But it does not negate the fact that your high blood pressure is causing damage. It does not negate that fact. So if you can't get that stress under control and you're allowing your high blood pressure as a result of stress to wreak havoc, what happens? If symptoms show, they don't take it seriously because it's mild. What are high blood pressure symptoms that, or I should say, when you now have effects of uncontrolled high blood pressure, is it really mild, Karishma? When you do have effects, negative effects of high blood pressure, are those effects mild? Ladies and gents, am I? Yes, Sarah. Yes. Am I? Myocardial infarction. Yes. What else? Stroke. Yes, yes. Come on, make Dr. Ignacio proud, or whoever is doing your clinical stuff. Come on, come on, come on. What else? Damage to the optic nerve. Yes. Visual disturbances. Right. Correct. Retinopathy. Yes. Right. 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 And Kai, I just going further. Kai, I just going further. Retinopathy and what Chelsea said, and Chelsea, you could do that. You could say it as well. Damage to the optic nerve. What are those called? What are those categorized as? A healthy person developing a clot in the leg. Kai, what kind of emoji is that? End organ damage? Nope. Yeah, well, yes, but that's not the category I'm looking for. Neurological. Yes, it's considered neurological, but that's not what I'm. It's a category. Anybody else want to help? Nobody? Microvascular complications. Microvascular complications. Yes, micro something. Yes, Karishma, micro something. Yes. So, getting back to it, persons don't take on high blood pressure because they usually are fit, especially sometimes the fit ones have high blood pressure. And they just simply do, I feel good, I feel normal, I don't have a problem. Oh God, yeah, the pressure is very high. But it's because they don't want to accept that they have a disease or an illness that requires treatment. And by engaging in self management support, it's going to help with that. It's going to help with that person understanding and appreciating that you have a chronic disease that, if not treated, can cause some problems. And how is this going to affect your life? And this is where this is where we now go about with the whole process of the self-management support, and we talk about emphasizing the patient's role, emphasizing the patient's role. It must be collaborative, and we have there a statement that if physicians view themselves as experts whose job it is to get patients to behave, or what we call that comply, compliance, right? Then no, both gonna get frustrated. The patient are gonna feel as though they're respected, and the physician is going to feel as though they're losing control over their patient. So it's not about the physician or the pharmacist taking control of the patient, but it's getting the patient to take control of themselves. And we talk about simple messages from the provider, being consistent with your approach, being culturally and linguistically appropriate. And here we go on slide number 14. Assess, advise, agree, assist, arrange, all for the benefit of that patient developing their personal action plan. All of these 5 A's, they have a measurable component to it, which is the confidence ruler. And the personal action plan are specific goals in terms of behavioral terms. Personal action plan would list out and look at the barriers that exist and the strategies now to address those barriers, looking at a follow-up plan and sharing that plan with the practice team. All right. So this is essentially, in a nutshell, what your self-management support is about. Your self-management, and this whole self-management support speaks to the notion of the concept of, it starts with E. What do we want our patients to become? Starts with E. We are now trying to provide and facilitate an enabling environment for them to become empowered. Yes, Samantha C. Empowered. So self-management support is about getting your patients to become empowered with what they have in front of them. Yes, Karina, empower. All right. So good, good. So that is essentially your self-care management support lecture. And at the end, we said that we wanted that gap that exists between professional and patient to get smaller. It starts off big and it gets smaller, smaller, and now becomes person to person, where both persons are part of the process that speaks to each other, that interacts with each other to get the best out of their particular disease management approach. All right, so that's self-care management. I invite any questions, any queries. We'll go for early break, and then we shall come back and when we return, we shall review. Hopefully, we can review maybe one or two lectures today. Let me see. We have. I know public healthcare was a long lecture. We could review two today, and then next week we could review another two, so we could leave some more time the following week to do anything backup, right? So when we return, we shall review those both lectures. Okay. Any questions? Any queries on this self-care management? All right. So we'll take a break now. We'll return at 10:05. Sorry, 11:05. All right.